Hello, Oswego City School District community. My name is Dr. Mathis Calvin, and I am the Superintendent of Schools for the Oswego City School District. Today I am joined by a number of guests from our district and our healthcare community who have all come together to discuss the latest health guidance that was put into practice late last week by the New York State Department of Health. For those who may be not aware, on last Thursday, the New York State Health Department disseminated a new toolkit for parents, guardians, and educational staff. This toolkit provides information on when it is appropriate for staff and students to be in school and/or quarantined due to their health condition. The state put out this universal guidance in an effort to ensure consistency and the health and safety of all learning communities across the state. Now, before we review this information, I'd like to first start by having our guests who are with me today introduce themselves to each of you. So I think I'll start on my left, and I'll have each of my guests introduce themselves.
Good morning or afternoon. I'm Dr. Robert Morgan. I'm the Medical Director for the Oswego City School District.
Good afternoon. I'm Diane Oldenburg. I'm the Senior Public Health Educator with the Oswego County Health Department.
Good afternoon, everybody. My name is Dr. Robert Duffy, and I'm the Director of Student Services in the City School District.
So let me start by saying how much I appreciate all of our guests who have joined us here today. Each of these folks have been working with us throughout the year to really make sure that we do a really great job and that we also ensure the health and safety of all of our kids. So again, I want to thank all of you today who are on with us for this special presentation. Okay, so with that said, let me start by sharing that there are several new documents in this new toolkit for parents and community members. These documents should be used by our parents, our students, and our staff to assist them with making decisions about when they should come to school, when they should quarantine, and also be seen by their healthcare provider. As we introduce them to you, I'm going to invite the assistance of Dr. Morgan and his staff members, and also Diane Oldenburg, to help me with reviewing each of these documents. So let's take a look at each of the documents. So the first document that we have here is entitled, Can my child go to school today? So I'm going to ask if Diane, if you can kind of just walk us through that document for just a couple minutes.
Sure. If you look across the top part of that document, if you have it in color, it's a red shaded area, and it asks really 4 different sections for you to answer yes or no questions to. So the first is, in the past 10 days, has your child been tested for COVID? And if you answer no to that question, you would move to the next section with, in the last 14 days, has your child traveled either internationally to a level 2 or 3 country, highlighted by the Center for Disease Control, or if you've traveled to any state or territory that's on the New York State travel advisory list. And lastly there, it would be also, have you been designated a contact person who has tested positive for COVID-19 and placed in quarantine by the local health department. So again, if you answer no, you would move to your next set of questions. And does your child currently have any of these COVID related symptoms in the last 10 days? So if you answer no to all those questions, then your child is able to go to school. If you answer yes to any of those, you move through this little algorithm, and it would give you next steps. So if you're waiting for a test result to come back, you should stay home till that result comes back. If that test is positive, of course your child wouldn't be eligible to come to school. Again, if you've traveled to those areas, then you would need to quarantine for 14 days. And then if you had those symptoms, we would want you to stay home until you're evaluated by a healthcare provider.
Great. Thank you very much. Now, the next document is entitled, My Child Has COVID-19, and When Can They Go Back to School? So I'm going to ask if Dr. Morgan, if you can walk us through now that particular document, if you could.
Sure. So again, and I think that throughout this process, it's going to be an easy flow, yes and no answering, so that we're trying to make this as easy as they could. So what we have to find out is, if somebody tested positive, we would stay out of school in an isolation until if we're waiting for it to come back if it's positive. You'd have to be in isolation. You'd have to be out 10 more days with after symptoms started. You have to have no fever for at least 72 hours or 3 days without using fever-reducing medicines like Tylenol or Motrin. While your child is being isolated, all family members living within the same house also need to be quarantined for the same length of time. If your child has the symptoms and then their test comes back negative and at least 24 hours without a fever, again, then your child can go back to school because the test came back negative. Now, if somebody chooses not to have a test done for one reason or another, then we have to treat them as if they were positive. So that we have to be careful with that. If they've seen a healthcare provider and their provider feels the symptoms are not related to the provider can give a release saying that it's not due to the COVID, and we can go from there. And again, if a child hasn't been evaluated by a healthcare provider, again, we need to treat as if it is a positive, so no symptoms for 10 days past when the first symptom happened. And that would be how you would discern when you can go back.
Great. Thank you, Dr. Morgan. So, we have quite a few staff members here at Oswego City School District, and certainly as we kind of work through this pandemic, we know that some of our staff from time to time might be affected by the pandemic. And so page 3 of this toolkit is entitled, Can I Go to Work at School Today? And it's really geared for our employees. And so we'd like to kind of just walk through that page if we could. So Diane, if you'd like to walk us through that page.
Sure, sure. And if you look again across the top of that algorithm, it's asking really the same questions as we had you ask for a child that would be attending in-person learning. So in the past 10 days, have you tested for the COVID virus? If yes, and then your test is negative, you can return to school. If that test was positive, then as Dr. Morgan pointed out, you'd be placed in isolation for a minimum of 10 days until your symptoms improve there. Traveling, so if you've traveled in the last 14 days, again, to any of those countries that are deemed a level 2 or level 3 country by the Center for Disease Control, or you've traveled to any of the states on the New York State travel advisory, then you would need to quarantine for 14 days once you've returned. The state, I'll just add that the states change every Tuesday. So you'd want to kind of keep an eye on that list for what states are on that travel advisory list as well. And again, then also if you have been designated a contact to someone who's tested positive for COVID-19. You would know that because you would get a call from the local health department to tell you were a contact and placed under quarantine. Then you wouldn't be able to go to work that day. And then you'd move to that next set of questions if you were able to clear the travel questions and the contact question to what symptoms are you currently experiencing that might be COVID related. So in the past 10 days, have you had one or more of these new or worsening symptoms? And that includes things like fever of greater than 100, if you feel feverish or have chills, cough, loss of taste and smell, fatigue or feeling tired, sore throat, shortness of breath or trouble breathing, nausea, vomiting, diarrhea, muscle pains or body aches, headaches, and nasal congestion or runny nose. So if you have any of those symptoms, you're going to need to not go to school that day and talk to your healthcare provider about being evaluated for those symptoms.
Great. Okay, so page 4 in the toolkit is entitled, I have COVID-19 symptoms. When can I go back to work at the school. And this is, again, another page for our employees. Dr.
Sure.
Morgan, can you walk us through that page?
Sure, and again, just like Diane, it's very similar to when we let students come back in. So with the symptoms, we want to make sure that people are getting tested. In the process of waiting for the test result, if it ends up being positive, then we have to have you isolated until at least 10 days after your symptoms starting, and quarantining along with your family members at home. And if your test comes back negative, according to this new guideline from the state, they're saying that you would need to be 24 hours without a fever before you can go back to work. There are other exceptions. Again, if your healthcare provider feels you have a chronic condition of allergies or something like that and still could go to work, then a note from your provider would now be accepted. If a COVID test was recommended, but the person did not want to have the test done, we have to assume it will be positive, and that would go along with even if you were not evaluated by a healthcare provider. Because without a testing, we need to assume that it might be positive for the safety of fellow employees and also for the students.
Great, thank you. So the next page in this toolkit is entitled COVID-19 Screening Flow Sheet for Students and Staff, and it really kind of deals with the screening that kind of needs to be occurring. Would you like to walk us through that page?
Sure, and I think this this page again really is targeting school administration and school nurses as their guide to those screening questions. And again, these screening questions haven't changed. It's just a flow sheet to help administration follow along, if you will, with those questions. So again, we're still asking about, have you had a COVID-19 test in the past 10 days? If you haven't, or if you have and it's a negative test, you can go to school. If the test result is positive or you're still waiting for that result, you should stay home. In the last 14 days, again, has a student or staff person traveled to outside the country to one of those level 2 or level 3 countries, or traveled within the United States or U.S. territories to areas that are on the New York State travel advisory. You're going to need to be quarantined for 14 days once you return from that travel. Or if you've been designated a contact, so you're placed under quarantine. Again, if you're under quarantine, you're not eligible to go to school or participate in person. And then again, we're looking for those new or worsening symptoms in the past, currently or in the past 10 days. Things like temperature, gastrointestinal illness, fever, chills, body aches, headaches. So again, those symptoms are put out by the Center for Disease Control and are listed on the flow sheet. So if you answer yes to those, any of those, we're going to ask you to be evaluated by a healthcare provider and potentially tested for COVID. If you answer no to those questions, then you're able to attend school in person.
Great, thank you. Now moving on to the next page in the toolkit. This page is entitled COVID-19 Flow Sheet for Students and Staff who have COVID-19 symptoms. And I'm going to ask Dr. Morgan if you can walk us through that one.
Sure. So again, if you have symptoms and the healthcare provider recommends that we have a COVID-19 test done, you're going to stay out of school waiting for those results to come back. Again, if the test is positive, then you're going to continue until you have no symptoms for 10 days after your initial symptoms and no fever for 72 hours, and your other members of your household would need to be quarantined as well. If your test was negative, as before, the guidelines from the Department of Health from New York State here says that for 24 hours without a fever, without taking Tylenol or Motrin or another reducing medicine, then you can go back. If your healthcare provider believes you have a chronic illness not related to a contagious thing as COVID, then your healthcare provider would send a note that would allow you to be at work. Again, when we have a test that was recommended but not taken, or if somebody did not see a healthcare provider and had these symptoms, then we would need to assume that you were positive and follow those guidelines for staying out at least 10 days after the first day of your symptoms and no fever for 72 hours. And that's where we would go.
Great. So we've got 2 pages left in this document, in this toolkit rather. And the next page in the toolkit is entitled COVID-19 Exclusions, Protocols for Contacts of Symptomatic Students and Staff. Why don't you take us through this page, Diane?
Okay. So as Dr. Morgan had mentioned before a little bit about, ideally we're hoping that any symptomatic students or staff are being evaluated within 48 hours. So if that evaluation is happening within that 48 hours, we're just simply following that flow sheet, the chart down on that left side, where again, either your healthcare provider gives you an alternative diagnosis. It's not COVID, it's strep throat, or it's, something else, allergies, whatever it might be. Then no exclusion then is required. Again, then if a diagnostic test for COVID-19 is not done, we're gonna follow the protocols that somebody's positive if they're not gonna be tested. If that diagnostic test is performed, then we're gonna go with what those test results say. So a positive test result, of course, you'll be excluded from school or work. Negative test result, you're free to attend school or work in person. So where I guess the tricky part comes in is if those things aren't done within 48 hours. So then is when we will treat that symptomatic person as if they're positive because we don't have an alternative diagnosis or we don't have a diagnostic test result to work from. And then that's when the health department will become involved and we'll treat that person if they're positive, and we'll follow our protocols for that. So it may be isolation of a student or staff member, so they wouldn't be able to come to school. They'd be under mandatory isolation orders with the county health department. Household members would be placed under quarantine, so moms, dads, brothers, sisters, and other contacts potentially could be placed under quarantine at that point. So after that 48 hours, if we do get a test result back, we do get an alternative diagnosis, then we will, reevaluate that and decide whether a student or staff member is then eligible to be released from isolation and other family members released from quarantine and begin that in-person education and work again.
Great, great. So I have one more page that I'd like to share, and since you did so great with the last one, I think maybe we'll have you introduce the last page to us. And that last page in the toolkit is entitled COVID-19 School and Local Health Department Coordination for Contact Tracing. And I know when we go through contact tracing, we're in contact a lot with you. So can you just walk us through this last page there?
Sure. And so, again, if you're looking at a in-color copy of this, then you'll see that yellow box, and that's really notifying the school district as to when the health department should be involved. So the schools are going to contact the local health department immediately upon learning of a positive case in a student or staff member, or 48 hours after symptom onset for a student or staff member if they don't have that documentation of an alternative diagnosis or a test result back. So in that case, then the local health department will get involved and we'll start sharing information. And it says that the school should share those contact information, school principal and designees. We've been working together a long time, and that stuff is already in place. So all we need is really that phone call, and we have all that information available to us to start that process. So then we are going to take on our communication process that we've already identified, and we'll begin to identify those contacts to that probable case. So we're going to look at family members and potentially any contacts they would have had in the school with students, colleagues, of staff members, to make those determination of who would need to be isolated and who may need to be placed under quarantine orders.
Absolutely. Well, great. So first, let me say thank you for sharing and walking us through each of those charts. So now I'm sure that after reviewing this information that several of our viewers today might have some questions. So in an effort to answer key questions that our community might have, I have a couple of questions that we've kind of put together for the entire panel. So the first question that I'd like to ask is really around that new guidance, and that is, how is the new guidance that we have now, how is that basically different from what we've been following in the past in terms of guidance? Sure, go right ahead.
Sure. So the previous guidance really outlined there were three really things that had to happen before someone could return to in-person education, and that would be to have that healthcare provider evaluation and a clearance to return to school or work. We needed that negative COVID test, and we needed those symptoms to be resolved. So now you have a couple different options as far as just having that provider evaluation and an alternative diagnosis, or having a negative test result instead of having to meet both of those. And we're looking for improving symptoms, of course, that kids could and staff could function appropriately in school as well.
Absolutely. Dr. Morgan, any difference in terms of, times that we should kind of be thinking about, 24 hours? I know there were some things out there before, and even in this document.
Initially, we had talked about a 72 hours of symptom-free, and the state kind of walked back on that a little bit, and we're heading into what historically is the beginning of a flu season. And we're not sure how flu and COVID are going to play in the sandbox together. So we still are trying to be even more conservative, saying that we prefer that somebody had 72 hours without any fever before they returned. Erring on the side of caution to help prevent spread, improve the safety of both staff and students. Where this is a nice guideline in many respects, we really would think it's best to be even a little bit more conservative before returning.
Great. So there may be some parents who have, some concerns about, COVID testing. So one question that I have is, if my child is sent home, for a parent again, if my child is sent home and doesn't have a COVID test done, what will he or she be allowed, or when will he or she be allowed to return to school? Just wondering what your thoughts are about that. Maybe Dr.
Well,
Murray?
as we had talked, and we kind of agree with the guidelines that were sent out with the state now, is if somebody does not have a test done, we have to assume that they have COVID-19. If they have a negative test, it's a tool that allows us to say that if symptoms are gone, we can move forward. But if somebody has chosen not to have a COVID test done, we have to assume that it's positive. We have to assume that the child should be quarantined, as well as other members of the family if we haven't had a test. The test is helpful to help us get people back to school and back to work as soon as possible.
Great. It is our hope that all in our community continue to stay safe and don't really have to contract this virus. But we know that there's a possibility that in some of our households we may have families with children who end up contracting the virus. So with that said, from a parent's perspective, and I want to kind of ask a question about maybe that parent who has multiple kids in the household. So if I have several children at home and one of my children has tested COVID-19 positive, should all of my children remain at home and be in isolation while at home?
Yeah, so if you have a child at home that tests positive, that child's going to be placed under isolation. And again, that will be for a minimum of 10 days. That isolation period will happen. Those other siblings that are contacts, assuming they're household contacts of that positive child, will be placed under quarantine for 14 days. So yeah, all those children in the house are going to need to stay home. As well as parents may need to stay home from work because they'd be placed under quarantine as well.
Great. Do you want to add anything to that?
Or grandma, or whoever else is in the house.
Whoever those household contacts with, or whoever's living.
Whoever their household has there. So that's.
Yeah.
Okay. That's really good information to know. And just as a follow-up, so if, let's say my child demonstrates a symptom, but a negative test result came out when my child, went to the doctor, so when should they be allowed to return to school?
Well, as we had talked before, we encouraged, we're a little more conservative. We like people to have no fever for 72 hours without taking any Motrin or Tylenol to make sure that they are no longer contagious. So that we're actually taking a little bit more conservative because we're concerned about our staff and our students.
Right. Great. So on another note, if my child's healthcare provider writes a note to say that my child has a chronic illness that is similar to a COVID-19 symptom, can my child return to school without having to take a COVID-19 test?
Yeah, that's a very good question, and that with the new guidelines from Albany here, the PCP, the healthcare provider, if he knows that this is a child with a chronic illness or another diagnosis with similar symptoms, that provider should clearly write in a note to return to school what that diagnosis is, why he or she feels this is not going to be a problem, so that we can help the school nurse as well as fellow students and other employees of the school know that the provider has evaluated this and stated it clearly in the note. And we're actually providing a note for the primary care physicians or providers to fill out, explaining all that, so it's very clear for mainly the school nurse, I think at their schools, to help them do their job, which is very, very difficult right now.
Absolutely. Thank you. So, what are some, some people may be thinking about, what are some things that we can do, to kind of keep kids safe? So with that said, what are some key universal precautions that parents should be paying close attention to at this particular time? Dr. Morgan?
Again, I think we do know that wearing a mask that works well, not just a shield. We've had conversations on that before. Trying to maintain your 6 feet distance and hand washing. And I think that we've done really an excellent job of having stations at all of our schools. And when the teachers set this example and everybody who's working sets the example, it's going to help the students set the example. If we all do it, that's the thing to do. Diane, anything else from
I would just add too that we want to continue. There's still in New York State limits on the sizes of gatherings. To really try to limit outside of school and work who you're gathering with, who you're hanging out with, how many groups of people are coming together, and pay attention to some of those executive orders that are still in place that do limit activities to a certain number.
And wear your mask when you're in those groups.
Absolutely.
And we're distancing today and have our mask off.
We're socially distanced,
so you can hear us better. But otherwise, when we all arrived here, we all had our masks off.
Everybody has their masks.
But we want you to be able to hear us today. So that's why we are doing this.
Absolutely. And I think it's important too to make sure, so we talked about the adults, but making sure that the kids, if they're with groups of folks, that they're having their mask on and that they're not in these larger groups as well, just to be on the safe side there. So, we talked a little bit about traveling. I'm just wondering, can you just share any additional information around the new guidance around traveling? Because I'm sure that as we start to move into the holidays, as we start to go towards breaks, that there may be people who want to travel from state to state or go from place to place. Just any other things you'd like to add around that question?
Like I said before, keep an eye out because it's really easy to get caught in a state that that isn't on the travel guidelines today, but in the middle of your vacation or holiday, it gets added to the state. So there is a required 14-day isolation period if you return back from those. I think one of the questions we're also have been getting in regards to school is if a parent or a family member within a household has traveled to one of those states and has come back and is under quarantine. Is it okay for a child that didn't travel to attend school? And yes, that's okay. They can. And you'll see in that screening question, it'll ask, has the child traveled, not has a household member
Okay.
traveled. So
That's great. Thank you for that clarification. So, if a student or staff member has worsening symptoms in the last 10 days, for example, cough or loss of taste or smell or fatigue, can they go to school?
No, they really should not go to school with any of those, just as the screening tools that we've been discussing. If they have those symptoms, they need to be in touch with their healthcare provider. Many of the healthcare providers are doing virtual or telemed visits. There are a
Right.
few primary care places that are doing them in person. Oswego Health has set up places at urgent cares as well. But they really need to be evaluated. They should not go to school and probably start the process of getting testing done, which would fall into one of the previous schematics that we have discussed already today. So symptomatology, very important to be seen and evaluated by a healthcare provider.
Great. And this next question is kind of really maybe a little redundant, but again, any other things that you would say, hey, students should be kept from school when this is occurring? Any other thing that you might add to that at all, Dr. Morgan or Diane?
I think these have covered most of them.
Right.
Again, it's going to get a little more complicated when the flu season starts.
Right.
Although I'm still optimistic because we're wearing masks that we may, and getting more people are getting flu shots. Maybe we'll have a smaller flu season this year. I'm trying to eternal optimist. So I'm hoping that that will be the case.
Right. So I know that we have some staff members that may be watching this, and some are, questioning, is there, any other new guidance that staff should follow that's listed in this toolkit that maybe they weren't listening or not listening, but maybe that they didn't hear before, excuse me?
no, I think really to look at that little crosswalk across the top of those
Right.
sheets to answer those yes or no questions as far as should you be in person at school for that day, and really looking and paying attention to those new symptoms
Right.
or worsening symptom.
Great, thank you. So what's difference? What is the difference, rather? Excuse me, between we have these different terminologies or acronyms, and can you share a little bit about what is a PCR, and then what's the difference between a PCR or an antigen testing for COVID-19?
Well, there are different techniques. Some of the more rapid tests are more antigen oriented, where the PCR is felt to be the more accurate. There are a number of different tests that are out there, and that's one of the issues. It would be nice if we all had the same tests,
Right.
But we don't, and that's across the country. It's not just here. It's nice to know a test rapidly. Some of them require a backup test, and the PCR is kind of held as this gold standard right now, and those are the ones that Oswego Health is primarily running at this time. But there's actually, it's not just two. Some of them are antigen based, some are PCR based, some rapid tests are PCR based. There's quite a collection that's out there. Have you heard an actual number of tests, Diane?
No, I think
I know it's 6 or 7 off the top of my head.
And I'm trying to think locally how many different, the traditional nasopharyngeal swab. I know that the hospital and Oswego Health are running is a PCR-based test.
There's a blood test, there's an oral test.
There's, the universities using saliva testing. So there's a variety of tests out there. Well, now I know they're a popular location lately to be tested, and they're using a PCR rapid test at this point.
So, when can my children go to, where can my kids go if I have a child who needs to be tested? Where can they go to get tested if they are, if we suspect that they have COVID-19? Where can they go?
What the best thing is and we have the Oswego Health Department and the Oswego Health ourselves here. We've tried to get information out to all the primary care providers out there that if somebody is a symptom, we have the places that Oswego Health has. We will do a telemedicine evaluation. We will say, yes, we think you need to be tested. We will put a lab slip in. We will say, here's some places that we can do them, which are closer to you. Sometimes how many tests are available. Pulaski has some, but we ran out of some of the rapid ones, so it changes around a little bit. And then they are given a time to go in. Some people they will go over to, well now, but there may be a 6 or 8 hour wait, and then you're in your car for that length of time. We are trying to use the Oswego Health system by giving times so that people don't wait. I don't mean there'd be no waiting, but you're given a specific time, and they've been pretty accurate about when they're, and we're not maxed out on the testing we can do, so we're trying to improve testing all the time with new machines which have better supply of reagents, and there's just some variables that have come into play. But your primary care provider should be able to arrange this testing locally.
Great.
We do the health department on our website at oswegocounty.com. If you go to the health department page, we have a section with COVID information, and we do try to keep an up-to-date list of there's one thing that you can click and say, where can I get tested close to me? You can put whatever zip code or location you want, and it'll pull some things up.
That's great.
We also do have a listing of the facilities that we know are running an operating testing site. So with phone numbers, whether or not you need a doctor's order for that, whether you need an appointment. So kind of you can look at what times and locations that work for you. And I think, I know Dr. Morgan, we've talked about this too, that we really want to encourage families. Just to run out and hit a test site might not always be the best option. And you really should be having that conversation with your primary care provider, because if it isn't COVID, it could be something else that is treatable, or that you really don't want a student or staff member in school with. So, so reaching out to your primary care provider and having that conversation is always a good start.
That's good. Great information. So just again, in terms of symptoms, parents may be thinking to themselves, what are those symptoms again that I should be looking for to determine, if my child needs to be tested for COVID-19? Can you just walk us through those symptoms again?
Sure. Unfortunately, we're finding that it's almost a lot of symptoms in there. So the ones that, the consistent, the highest ranking ones are fever and cough. They are still the highest ones. But we now know that the loss of taste and smell, which initially was felt to be very rare, is more common than originally was thinking was. Just feeling tired, a sore throat. The shortness of breath, if you've had symptoms for a few days, tends to show up. It doesn't, not as much in the beginning, but if you've had it for 3 days or something like that. Some nausea and vomiting, and even some diarrhea. Now, if you have diarrhea once, is that a COVID thing? Probably not. It's if you've had 3 or 4 or 5 episodes. You can have body aches like any other virus. Unfortunately, being a virus, these things are all in there. So it's, in the world we're in right now, the symptoms of your common cold, unfortunately, are also the same symptoms of COVID-19.
I think the only one you're not going to find on there is sneezing.
That's right.
Okay.
I know
that's
that's something that we look at, and we try to track the patients that we're working with and have interviewed. And right now, fatigue seems to be our leading symptom, along with fever. But we know we've had some patients where diarrhea was their only symptom, or fever might have been their only symptom. So unfortunately, it makes fighting this virus really tricky.
Yes.
That's why our list of screening is rather long.
Yeah.
Right. Wow, that's great. Good information. So again, just kind of looping back again. So under what circumstances should I be isolating or quarantining my children again, would you say?
Right. So those official kind of isolation or quarantine orders will come from the local health department.
Okay.
And again, isolation is based on somebody that is tested positive and is sick. that tends to be a little shorter period, a minimum of 10 days for someone that actually is tested positive for COVID-19. And those that are going to be placed on quarantine are people that are close contacts to those. So when we're talking close contact and doing an investigation, we're really looking for people that would have been within 6 feet of somebody that's positive for 10 to 15 minutes. And then that would determine whether somebody may need to be placed under quarantine. That quarantine is going to last for 14 days. We often get the question, I'm under quarantine. If I go get tested and I'm negative, I'm out, right? No. So you have to stay under, again, we do that based on the incubation period.
I see.
That can be anywhere from 2 to 14 days. And we have had some people on day 13 start to show symptoms. So it's important that we hold to that 14-day period. Regardless of a negative test at that point.
So again, if my child has been out of school due to COVID-19, when can he or she return to school again?
So ideally, what the school's going to ask for is that release of isolation from the local health department. So if they're Oswego County residents, that would come from the Oswego County Health Department. It's going to be a minimum of 10 days, either from the day their symptoms started. If they don't have any symptoms, then 10 days from the day they tested positive. And again, we're going to evaluate. We call those patients daily to check on their status. We're looking to see that their symptoms have improved that last 72 hours of their isolation period. And if they're feeling better and well, they'll be released. If they're still sick, they may still be running a fever. Maybe their cough hasn't improved. We may extend that out a day or two. So we usually tell people a minimum of 10 days. By 10 days, most people are feeling pretty well and are released from isolation.
That's great. That's great. So just in terms of the district, from time to time, parents may have questions on whether they should send their children to school, or they may want to just kind of talk through some of the concerns that they may be seeing that's demonstrated with their child with respect to school. So I guess the question is, who could they contact at the school district to assist them? You know, we have Dr. Duffy, who's here with us, who has kind of been left out of the conversation a little bit here, but he's with us, so maybe he can help us with answering this particular question.
Sure,
Thanks.
absolutely. So it's important to know that there's a number of resources that are available to everybody, and probably the biggest one that I can think of is the COVID hotline that we have, which is at 315-341-2050. Now, when you call that hotline, you're going to be greeted with a menu. The menu is going to ask you pretty much if your question is school specific, or if it is district specific, or if it is a universal question as regards COVID. If you're not sure, that's fine. You can always just leave a message. We have a dedicated nurse who is working full-time on our COVID hotline to make sure to address all the questions that you have regarding what to do. If you want something more immediate or something that you think doesn't have to go to the hotline, that's fine too. It's important to remember that your school nurse is probably your best contact if the hotline, for whatever reason, is not working for you. So make sure to use those resources that we have.
Great. Thank you so much, Dr. Duffy. And with that said, let me just be clear. I want to thank all of our guests for their efforts today and for answering all of our questions. Secondly, our viewers and community should know that this special toolkit can be found on the district's main webpage under the COVID-19 link. Again, should anyone have any questions about this, they can contact their school nurse or the district's COVID-19 hotline. Our hotline phone number, again, is 315-341-2050. And so with that said, I'd like to give our guests a moment again to share anything that maybe we have not covered during our Q&A section of this video. I'm going to let them have kind of like the final words here.
Diane, go ahead first.
Thanks. So, yeah, the health department continues. I think we work daily with not just the Oswego City School District, but all the other school districts in the county as well. We do have a hotline number as well at 315-349-3330. That's staffed during the week from 8:30 to 4. If you have maybe more community-wide questions and not school specific questions. And our webpage, we try to keep that up to date with the latest guidelines and, like I said, testing information. And we thank the community for working so hard to help follow all those safety precautions that are being put in place, mask wearing and social distancing, and limiting your crowd sizes and gatherings.
Excellent. Thank you.
Thanks.
Thank you.
Yeah, we really appreciate everybody's cooperation and understanding. It's an historic time, and it's for all of us. And our number one priority is the safety of our students, of our faculty, and everybody who's in staff at the schools. And if we all do our part, and we all do the simple things that Diane says, and limit exposure, we're going to get through this. We're going to get through this. So we thank everybody for being part of the solution.
That's great. Dr. Duffy?
Yes, just one thing. Please make sure to use our resources. They're there for you, and we're happy to walk you through this process.
Great. So again, let me thank all of you for joining us today. And as we end, I'd like to remind everyone of three really important things that I think we can all do right away to keep everyone safe in our whole entire community. So the first is making sure that we wear our mask, right? Masking is really important. The second is that we continue to socially distance. You see how we are socially distanced here. And we're encouraging everyone in our entire community to socially distance themselves. And the third is to make sure that you're washing your hands for at least 20 seconds or more and or using hand sanitizer while you are here in our community and when you're at home and when you're about, basically. And so with that said, again, we want to encourage everyone to please be safe. And we want to thank you all again for joining us today for this new information. And we really wish everyone a really great day. And again, thank you, Dr. Morgan. Thank you so much, Diane Oldenburg. And thank you, Dr. Duffy, for all of your help and all of your support. And please, everyone, be safe. And again, don't forget the mask. Don't forget to socially distance. And please don't forget to wash your hands. Have a great day. I'm going to mask right now. Bye-bye.